Good afternoon. It's Monday, and here we are. It's a full day already. I'm Amy Casadena Hall. I'm a Senior Vice President at United Way of Connecticut. And on behalf of all the United Ways in Connecticut, I want to thank everyone for joining us this afternoon for an opportunity to come together and learn from our experts in Connecticut about how we can work together to navigate the changes with SNAP and Medicaid with, again, the people leading the charge in Connecticut on this, really with the goal of helping as many people as possible retain their benefits or regain their benefits if they've been at risk, or access community services if that's what would be helpful for them at this point in time. So just to make sure, I'm going to open with some housekeeping, run through our agenda, and then we will kick off. You probably already saw this as you were entering in, but the session is being recorded. And yes, we will share the recording after the session. So just to let you know, we're being recorded and it will be shared out. Today is our opportunity to come together with the staff at Connecticut Department of Social Services to talk about the policy changes affecting Connecticut residents and how, as supporters in the community, we can help the people we serve, our constituents, navigate these changes and preserve their benefits to the best of their ability, or understand why and how their benefits are changing to help people respond. We will not be talking about any individual cases or any individual's household benefits today. If you do need help with your benefits, please contact the Department of Social Services or an organization in your community, like your action agency, that can help you navigate changes to your individual households. Again, today we will not be discussing any individual cases. We will be talking about how systems and benefits are changing and how people can be prepared to support people to navigate those changes as successfully as possible. We are in webinar format. That does mean everyone is muted. The chat should be disabled, but we would love to do Q&A. And I know people are already doing it, but please put any questions you have in using the Q&A function. We're going to be watching this, looking at the Q&A during our thing. We'll feed up a few questions, but we'll certainly save time at the end for Q&A. So please, if you have a question, use the Q&A function. I'm still getting from some folks that they're hearing an echo. I don't know what to do about that. I don't know if any of our tech folks have any great insight on that. But some people are and some people aren't. So sorry about that if you're having quality issues. And I truly hope you can still participate today and that it doesn't come through in the recording. So we'll be trying to keep our eye on that and looking to see if there's anything that we can do on our end. All right. So our agenda for today, we're going to open with by hearing from our Commissioner of Department of Social Services, Commissioner Andrea Barton-Reeves. We're then going to hand it over to really dive into the SNAP and Medicaid changes with an overview by Deputy Commissioner Peter Hadler. Oh, we misspelled your name, Peter. My apologies. No end. You're not the handler. You're the Hadler. Thank you for Peter. And Director of Program Oversight and Grant Administration, Daniel Giacomi. Wonderful. All right. And then again, we'll have time for Q&A. I want to thank all of our panelists for being here. I want to thank the United Ways in Connecticut who helped push this information out, and all the other organizations. I want to thank Suzette DeBeetham-Brown, who's with us today, who was our point person working to implement these changes. And of course, my team, Jeanette and Gio, who helped make the webinar happen. So thank you all in advance. So I just want to say I am so proud to introduce Commissioner Andrea Barton-Reeves. I think of the commissioner as the founding person who brought Connecticut paid family leave to life in Connecticut. Such a huge, huge program for the state, a program I've benefited from and been life-changing for so many families. And now for more than 3 years, we've had her leadership at Connecticut Department of Social Services as commissioner, where she oversees, this kind of made my head explode, Medicaid, childcare, and food assistance for over 1 million Connecticut residents, helping both the state and all of us and the people who are benefiting from these services navigate many changes, including, of course, the implementation of HR 1 and its implication for both SNAP and Medicaid. So, Commissioner, would you like to open us up?
Sure. Thank you, Amy. I appreciate the opportunity to be here today. So, welcome everyone. I'm just watching the numbers climb rapidly in terms of participation, and we appreciate the interest that all of you have as our community partners in navigating what really are substantial changes to the ways in which Medicaid and SNAP will work across the United States. I'm very fortunate, of course, to have our colleagues here today, who Amy's already introduced: Dan Giacomi, Deputy Commissioner Peter Hadler, and Suzette DeBethan Brown, who is a special advisor to the commissioner sitting in the commissioner's office. Today, we'll have an opportunity to really talk about the basics of the changes that are happening in HR 1 as it relates to Medicaid and SNAP. And you'll also hear some statistics about the real world impact we're already experiencing as a result of those changes. So, as an example of that, we had 342,000 people approximately who are enrolled in SNAP benefits in Connecticut. And so far, we have seen a drop to about 303,000 people. And that is precipitous, and it continues to fall, which is the direction, of course, that many of us are most alarmed about. Then, of course, starting in January of next year, we will see the changes that have been implemented, that will be implemented as a result of HR 1, impact our Medicaid Husky D population. This is very real. I don't have to tell any of you this who are on this call today, because you do understand the direct, immediate human impact that these changes have on the communities that we serve. So we're actually very glad that you're all here, because we'll have an opportunity to speak with you directly about what's going on, to answer any questions that you might have. And those that we can't get to, we'll try to make arrangements to answer those after we leave this webinar today. But we're so grateful to you for your commitment and your partnership to make this change that has really just obviously been it, it's impacted all of us, I'll just put it that way, across the country, to try to do the best that we can to take care of the people who really rely on SNAP and Medicaid as a means of living a life of dignity and purpose. So with that, I will turn it back to you, Amy, and we will start, I imagine, with Deputy Commissioner Hadler.
Thank you so much. Thank you for being here, and thank you for setting the stage for us. Those are not easy messages, but we appreciate the candor, the clarity, and bringing us all together so we can all work together, to your point, to help turn the curve on those numbers as best as we can and support every resident in ways that we can. So, in no surprise, we've got a PowerPoint for you. So let's get that PowerPoint loaded, and then let's get into what we all need to know and what we can do.
Excellent. Thank you, Amy, and thank you, Commissioner, for getting us started today. Dan and I are very happy to be able to give you a high-level overview of both the work requirement impacts in the SNAP and the Medicaid program, and some more concrete examples of how those changes are playing out on the ground level. Hopefully give you some ideas for how you might be able to support our members in the community who are being impacted by these changes. In particular, we'll start with the SNAP program, as those changes are in effect right now. Those HR 1 changes that came out of the federal government from last year are rippling across the state right now as we speak. And so we would love to be able to give you a little bit more detail and update on a reminder of what some of those changes are, how they're impacting the population, and a couple of case examples that might help as a useful framework for how you might be able to support an individual who's going through some of these changes. And Dan is going to run through the SNAP section, and then I will talk a little bit about the changes that are coming to Medicaid, as well as to offer up some resources that you all might be able to take advantage of. And again, of course, our presentation will be shared afterwards. So, feel free to take notes or not. And the links will be available to you, hopefully as sort of a reference tool going forward. So with that said, I'm going to pass it off to Dan to talk a little bit more about the SNAP changes.
Thank you, Deputy Commissioner, and good afternoon, everyone. Jumping right into it. So what are the work requirement changes that are coming along? You may hear them gone by different names. You may hear work requirements, you may hear work rules, you may hear the terminology community engagement. You may also hear some sort of inside baseball that often SNAP policy folks use, called ABODs, or able-bodied adults without dependents. You may hear it by a bunch of different names, but by and large, what it means is, as you see on the screen, as of December 1st, 2025, certain adult SNAP recipients, and later on in the presentation, you'll see similarly, Medicaid recipients must do one of the following each month to keep their benefits. unless they meet what's called a qualifying exemption or an exception to the rules. The first and most straightforward is they must work at least 80 hours or make at least $217.50 a week. The 80 hours is a monthly average. It would average to about 20 hours per week, but in totality, it would be 80 hours. The $217.50 does not take into account, for example, Connecticut's higher than federally required minimum wage. So we in Connecticut have a minimum wage of around $17 or just under $17, which means if you divided the $217.50 per week by our Connecticut minimum wage, it would be about less than, I would say, 20 hours a week. It would be around 55 hours a month that these individuals would be working to meet that requirement. If they're not working, they could be in a job training or work program, such as the SNAP Employment and Training Program, or what we call CT Pathways here in Connecticut, for at least 80 hours a month, or they could be volunteering for at least 80 hours a month. One of the other good things about this is you can do a mix of one or all three of those to come up with a total of 80 hours a month. So you can be working for, 40 hours and volunteering for 40 hours in a month, and that would still allow you to meet these work requirements or community engagement requirements, as long as when totaled up, it meets or exceeds the 80 hours. Next slide, please. So I saw one of the questions already coming through in the Q&A, which we're so excited to have today, is who do we see that are falling off, or who do we see has to meet these new requirements in order to continue receiving assistance? As I mentioned earlier, we previously referred to them as able-bodied adults without dependents, meaning individuals who were between the ages of 18 and 55 and did not have any children under the age of 18 in their household. That became a bit of a misnomer with HR 1, and we started looking at them more as just simply time-limited individuals that had a time limit to the amount of assistance that they could receive. And the reason is because as a result of HR 1, we've now seen the upper bound age limit for these individuals increase by 10 years up through age 64. And we also saw that the age limit for those children that made them exempt from the work rules was decreased from under age 18 to now living with a child under the age of 14. So birth through their 13th year would be exempt, but anyone with a child in the household who is 14 and up now would have to meet these work requirements or be identified as having a qualifying exemption. And obviously, as we said, without dependents and able-bodied, meaning they have to work or they can work. That would include whether their inability to work is physically or mentally or something otherwise, but they would have to be able to work in order for them, or as I said, be exempt from those work requirements by not being able to work. However, if they do not have an exemption, they're not meeting the work requirements, what it really means is that that SNAP recipient can only get SNAP benefits for 3 months out of every 36-month period, unless they met those work rules or they were exempt. The question that we get quite often is, when does that 36 months start? Well, really, it's unique to each individual applying for or receiving benefits from DSS. It starts with their first full month of the receipt of SNAP benefits. That would start their 36-month period on an individual basis. So it's not a universal time clock that everyone has the same time frame. So the example we gave is that if an individual were to come in and apply with us today, May 11th, for SNAP benefits, and they were granted and they are not meeting the work rules and they do not have an exemption, their 36-month period, their first countable month towards their 36-month period would be June, because we are partway through, or just about partway through, the month of May. It is not a full month, so this month does not count, and it would start effective June. So they would then be able to receive benefits for June, July, and August. And if at the end of August we have not identified that they're meeting those work rules or they are exempt from them, they would no longer be able to receive benefits starting in September. They would be closed out at the end of August. How do they report their compliance or meeting the work rules or their exemption, as you see on the right-hand side of the screen? They're expected to report it through to DSS at application or renewal, or it says when changes occur. And primarily those changes are for individuals who were previously exempt and then no longer meet an exemption, or who were meeting the work rules and then their work hours or their combination drops below the 80 for the month. They would then by the next month have to report to us, hey, I was previously meeting the work rules. I no longer am able to. And they could do that by uploading their information through our MyDSS mobile application or through our Connect client portal, which at the end of this presentation, we'll have links for all of those for individuals as well to look at and take as a reference. Next slide, please. So as DC Hadler mentioned, we didn't want to overload everyone with just pretty heavy policy information. We also wanted to provide some fictional case examples of individuals who may be interfacing with DSS as well as with community partners and what they could do in these situations or what their next steps may be. So in this case, meet Marcus. Marcus is a 28-year-old single adult who lives alone and relies on SNAP for his food support. As you see, he works about 15 hours a week, which comes out to approximately 60 hours a month. And he also participates in an approved training program for another 20 hours a month. So as you may be saying to yourself, similarly, if you combine those up, Marcus is meeting the 80 hours through the combination of the training program and the work. However, unfortunately, Marcus receives a notice of discontinuance for SNAP indicating he's not meeting the work requirement. As most would be, Marcus is confused as he believes his part-time job and training hours should amount to the required 80 hours per month. But then thinks to himself, having gotten help from a community action agency in the past, he should and does reach out to them again to understand the notice and to figure out what he should do next. Next slide, please. So Marcus does meet with a community action agency worker. An outreach worker takes the time to review Marcus's situation, looking at both his work hours and his participation in the training program. Through this review and through this partnership, it's decided that only his employment hours are currently reflected by DSS, and the DSS is not counting his training hours. His training activities don't appear to be reported or verified. So he still may be eligible. However, DSS will need a verification of his training hours to ensure his case is accurate. A question that we've gotten often is, well, how does DSS report this? What does DSS need in order to verify this? While we are working on a standardized form, we'd like to not limit individuals to just having the form. What we'd like to tell individuals is we need a letter from whoever you're volunteering with or whoever you're training that says the number of hours that you're in training each month, and that has the authorized signature and telephone number of someone in the training program or volunteer program, so that we could verify that if we had questions about the training or volunteer work that individuals may do. As I said, we are working on a specific form. As I'm sure you're aware, with any forms that we send in, there are some technical requirements that we have to make sure we have in place in order to have it read by our system and not be at chance of being lost. So while we work to finalize that, what we would say is as long as we have that information from the program with the specific information and telephone number and hours of attendance or participation, we would accept that letter as verification. However, in addition to that, the outreach worker supports Marcus by explaining the work requirements in a clear and simple way, reviewing his notice and helping him understand why his benefits are being discontinued, discussing all of his activities, including work and training, identifying that it may not have been reported and letting Marcus know that that's the reason and that is not the fault of Marcus that he's getting this discontinuous notice, assisting him with gathering and submitting the necessary verification, ensuring that he doesn't have to submit documents multiple times because perhaps it's missing some information or it's not clear, encouraging him to follow up with DSS so his case can be updated, and connecting him with additional supports if needed while his ongoing eligibility is under review. Next slide, please. With that being said, as we noted, there are still exemptions that do apply for those individuals that are time limited. Not all of the exemptions that were previously available to us have gone away. There are still a robust list of exemptions available. We noted that an individual outside of the ages of 18 and 65 is not beholden to the work requirements. Similarly, we already spoke of having a child in the household under the age of 14, understanding that that child does not necessarily have to be on the SNAP assistance with the individual that is applying. They could have a physical or mental health issue preventing from work, be pregnant, or as you see, there's a whole host of others on there applying for and getting unemployment benefits, applying for and getting disability benefits. And the one that we like to point out specifically is the VA benefits. As you'll hear later on in the conversation, there is a little bit of a differential between the VA benefits for SNAP and for Medicaid. For the SNAP program specifically, the receipt of VA disability benefits, regardless of the individual's disability rating, would exempt that individual from the SNAP work rules. It could be a 30% disability rating, it could be a 60% disability rating. SNAP guidelines thus far have said specifically that it does not matter what their rating is, they can still receive SNAP benefits with an exemption to the work rules. One of the other questions that we got as well is, what does it mean to have a physical or mental health issue preventing work? The federal government is not super prescriptive of it. They say that the state can devise its own standards as long as they're uniformly applied and they're not less restrictive than Social Security standards themselves. So we've put out guidance to staff that if an individual presents in our offices with an obvious physical or mental health disability, they may use that as a determination as being unable to work. Or similarly, we did create a form and it is available on our website, which again, we'll show you in a little bit where to find that, where a doctor or other medical provider can fill out. It's literally one question that says, does this patient have a temporary or permanent mental or physical illness or disability that prevents him and her from working at least 20 hours per week on average? And then has a yes or no checkbox there. If DSS were to receive this form and it was signed by a licensed medical provider, we would accept that as determination that the individual is unable to work and would then exempt them from the work requirements. Next slide, please. One of the largest changes that we in Connecticut, as well as our partners throughout the state, did identify as a result of HR 1 were how we were able to apply for what we called a annual exemption based on work in a town or area. Previously, DSS could request a federal waiver, and we did so on an annual basis, from work rules for towns whose unemployment rates were 20% above the national average over a 2-year period. So we would undertake an exercise each year to look at the previous 2 years' unemployment rates, both nationally and here in Connecticut. We would identify towns that themselves had rates above the 20% average, or through the contiguous area of towns in a grouping were above the 20% average. What you'll see in the middle of the screen here is 2 different colors. So those blue colored, the darker blue colors, are those whose towns themselves had an unemployment rate 20% above the national average over the most recent 2-year period when we had an available waiver. And those with the light blue were towns that themselves did not have an average over 20%, but through the grouping of towns in a contiguous area were over the 20%. So they were eligible based on where they resided in relation to the other towns in their area. That's the only distinction between the 2 colors, but we like to point it out as that's a question we get, is what is the difference between the 2? Unfortunately, under HR 1, however, those waivers were done away and we're only allowed to apply for waivers where towns have an unemployment average above 10%. When we looked at the most recent data, and we've continued to look at that data, there's less than 10 counties or towns throughout the United States that fit that criteria, and unfortunately, none of them are in Connecticut. So what it meant is that 68 towns that had a time limit waiver in Connecticut in 2025 no longer qualify, and there are currently no Connecticut towns meeting this threshold. Um, as we said, what that meant, the impacted populations of individuals was around 20,000 individuals that were exempt from the work rules as a result of this waiver that now had to either meet the work rules or identify a different exemption in order to continue receiving SNAP benefits after their 3-month period. You'll see some other impacted populations that we'll speak of in regard to losses that were either exemptions that were lost, such as those for veterans. Those for, I should say, veterans that do not have a disability, because we already mentioned the disability payments on the prior screen. There were also exemptions for those individuals experiencing homelessness, those who were considered former foster youth between the ages of 18 and 24, and those non-citizen categories, which we're not necessarily discussing in depth here today, but those that were previously eligible based on their non-citizenship category that are no longer eligible, specifically refugees, asylees, parolees, and trafficking survivors. Next slide, please.
Dan,
Yes.
can we pause here for a moment, actually?
Absolutely.
This was great. This was already a ton of information, and we have lots of questions, but we've also got some questions kind of about the fundamentals that I just want to put in front of you first, just to make sure we're all moving from the same place. So it sounds like one huge thing to walk away with is that 3 out of 36 months. So if people, can you just clarify that one more time?
Yep.
Who that applies to?
Yes. So individuals who are between the ages of 18 through 64, so under age 65, can, if they're not meeting the work rules, so they're not working at least 80 hours a month, they're not volunteering or doing a combination, and do not have one of the qualifying exemptions that we listed on the prior screen, can only receive 3 months worth of SNAP benefits in a 3-year period.
Thank you. I appreciate that. And so on the previous slide, we saw a list of exemptions that are still in place, but this slide highlights exemptions that are no longer in place.
Exactly.
Right?
Correct.
That we're used to, both placed on where you live and the unemployment rate, and then kind of characteristics or status of a household or an individual. So we see here. Great.
Absolutely.
Thank you
Yep.
for clarifying that. Another question that came in, the earnings amount of $217.50, that's gross income?
That is gross income before any taxes or deductions, yes.
And 80 hours a month is what we're looking for, of any combination of work, volunteer, or training/education. Is that accurate?
Correct as well, yes.
Great. Just making sure a few things came about that. And people will find out if their benefits are discontinued from a letter that comes from DSS. Is there any other way, or will people just be like, my card doesn't work? Just to shed a little light on that process.
Sure. Yeah, before we discontinue anyone from assistance, we do have to send out a letter to let them know that they are no longer eligible and that their benefits will either be reduced if you have a mixed household of someone with an exemption and someone without, or closed off if everyone in the household is no longer eligible. So you will have a chance to request a reconsideration, or what we call fair hearing, in advance of that if you believe we've made a mistake. But you will, in any situation, receive a letter that says your benefits are going to be closed as a result of these new rules.
Thank you. Lots of other questions, but those seem kind of like headline factors to understand about the changes.
Understood, and appreciate you providing them to me so I could add some clarification. Gio, if we want to go to the next slide, please. Thank you. So I'll just clarify. You'll seeing a heat map on the right side of the screen there. That was a point in time map of the individuals affected by the time limits due to, as I said, the ABOD, or able-bodied adults without dependents work requirement, versus as those active within a town. It does change as obviously more people become enrolled or lose assistance. So it is a fluid map itself, but that was a point in time when we looked at it. But what we were seeing just by and large, as you heard Commissioner Barton Reeves mention earlier, in October 2025, there were around 342,000 Connecticut residents receiving SNAP. As of April 2026, that number has dropped to approximately 303,000. Many of those losses are coming as a result of our non-citizenship changes that we spoke a bit about, but the overwhelming majority are coming as a result of work requirements or failure to meet work requirements or being exempt from them. A significant portion of that drop, as I noted earlier, was the 20,000 people who lost their town exemptions and became subject to the work rules, who were unable to identify a new exemption or to meet the work requirements. Because unfortunately for us, the work situation in those areas or those towns did not change as a result of HR 1. The only thing that changed was our ability to exempt them from those work rules previously. Next slide, please. So here's another situation. Meet Graham. Graham wants to be a bit proactive, so he visits the DSS website, which is portal.ct.gov/SNAP work rules, no spaces there. To fill out, when he sees on the first screen is the SNAP work rules pre-screener tool. What that tool does is give Graham the ability to answer, I think, no more than 10 or 11 questions, yes or no, as to whether or not any of the exemptions apply to him, or if he believes any of the exemptions apply to him. If he were to say yes to any of the questions, it'll tell him the next steps he could take to ensure DSS knows that he meets the exemption. However, if he says no, and in this scenario, Graham did say no to all of the questions, he received a result that he was not eligible from an exemption to the work rules. What does that mean as an impact? Well, as we just kind of mentioned through Amy and I's question and answer just previously, he will only be eligible for 3 months of SNAP benefits in a 3-year period, unless at some point in time between then and when he closed out, he met the work rules or was able to identify an exemption himself. However, what does Graham do? If we go to the next slide, please. Gio, are you able to advance? Thank you. What Graham does, Graham enters his information on the last screen of our pre-screener of the city and town he resides in. What it does for him is it identifies which community action agency is serving his area. It also indicates that a SNAP navigator is available there to assist with him. So Graham decides to meet with Susan, the SNAP navigator. Susan reviews the eligibility criteria again, just to make sure that Graham is answering the questions correctly or clarifies any information that Graham may have not understood or thought of in different situations, and confirms the results that Graham is not exempt and is only eligible for 3 months of SNAP benefits. Susan does let Graham know that he must start working or volunteering or identify and qualify for a different exemption to get SNAP benefits after the 3 months that he's currently eligible for. Next slide, please. She also lets him know that if he meets the work requirements or qualifies for an exemption within the 3-month period, while his SNAP is still active, Susan can help him assist with uploading those verification documents into MyDSS or Connect, help report updated information to support continued eligibility, provide some guidance to Graham on what some of the acceptable documents are that he can use to verify his information, and supports him overall through the process to make sure he maintains his SNAP eligibility. If she were to look at the situation or through talking with Graham, she understands that his benefits have already closed due to the work requirement time limits. She informs him and lets him know that he can regain the SNAP eligibility later in the 36-month period by meeting the work requirements or qualifying for an exemption, but made sure to inform him he may need to reapply for SNAP, and to let him know that he can reapply at any time in that 36-month period. He does not need to wait until the 36 months ends until he can reapply again. Just understanding that if he were to reapply and he has not met the work requirements or does not have an exemption, he would be denied for assistance at that time. But Susan can help guide him through that application and documentation process, ensuring he's only doing it in a time that would be advantageous to him. If he does not take any action to meet the work requirements or qualify for an exemption, she reminds him his benefits will not continue and he would be ineligible for the remainder of the 36-month period. Next slide, please. In addition to just support with DSS and our processes, Susan can also help with referral to employment opportunities or education and training opportunities and programs within his area, perhaps at the community college or somewhere else that's offering them. Referrals to volunteer opportunities through any of the partners throughout the state, or additional support agencies or food pantries or resources that can assist Graham with meeting his nutritional needs if DSS is no longer able to do so. With that, I'd like to turn it back over to Deputy Commissioner Hadler to go over our Medicaid work requirements.
Thanks, Dan. That was a lot to absorb. We thank everybody for getting the details that Dan was so able to provide. And I'm going to be a little bit simpler on my side of the world because some of these changes are still to come on the Medicaid side. So I want to lay the groundwork for where we are today in implementing Medicaid work requirements, what we know and don't know, and just to help advise folks that there will be additional materials coming forth that will be able to help elaborate some of these operational pathways. I see some of the questions that are in the chat. We'll have an opportunity to answer some of those as it pertains in particular to SNAP, recognizing that some of that is very much live, and we appreciate that folks are working to help the members of our community that are impacted by those SNAP changes. But just to go back to sort of square one on Medicaid work requirements, there are no work requirements in Medicaid right now. That is going to change on January 1st, 2027. So enrollees in the Husky D program, and only Husky D, will need to meet work requirements or community engagement rules to get or keep coverage. So what does that mean in the Medicaid context? It's similar, but not the same as in the SNAP world. There will still be a requirement that aligns around 80 hours a month, which could be a combination of work, community service, participation in a qualified worker training program, enrollment at least half-time in an education program, or some combination thereof. This is very similar to SNAP. What is a little bit different, though, is the income threshold that you might need to demonstrate to show compliance. For Medicaid, that threshold is being set at $580 a month, which is the federal minimum wage times 80 hours. So again, a little bit of a nuanced difference. And just wanted to highlight that as we start to look forward to the time when these rules will be in effect for the Husky D population. Next slide, please. So there are also some exemptions for Medicaid. And some of these we know all about, and some of them we are still working and waiting for some federal guidance about some of the nuanced details about how some of these exemptions will be allowed to be effectuated in Connecticut and other states. I do want to go through them briefly and highlight some of the ones that are different from the SNAP program. There are also quite a bit of overlap. So we'll start with the veterans. For veterans, you have to have a disability rated as total in order to qualify for a Medicaid work exemption under the Husky D program. That is obviously different, as Dan explained for the SNAP program. Any disability rating for SNAP will lead to an exemption for the work requirements. But for Medicaid, that will be a total. And note that total is not the same as 100% disability. If you get into the nuances of veterans' disability questions and how those things are broken down, obviously, I think our veterans community is highly attuned to what their particular status may be. But for those who may be assisting someone, just wanted to highlight that difference between SNAP and Medicaid. And the next category is one that is known as medically frail. This has some parallels to the SNAP physically or mentally unfit for work, but it's not exactly the same. So we do have some categories within that structure, such as folks who are blind or disabled, children with serious emotional disturbances, adults with serious mental illness, chronic substance use disorders, and serious and complex medical conditions. This is a definition that is really evolving over time as states look to implement that definition across the state. We do anticipate that Connecticut will be able to incorporate a lot of potential medical conditions under that umbrella. There will be a lot more detail about what things qualify for that category as we get more information from our federal partners and as we get closer to January 1st. That information will be widely disseminated, and it should be clear to anyone who is seeking an exemption for Medicaid work requirements, whether they might fit under medical frailty and what might or might not need to be shown in order to qualify, because we do hope to be able to leverage data that we know about the participants in our program and the medical services they have access to help them ascertain if they have an exemption for the Medicaid work requirements. Another category, this again is similar to the one in SNAP, alcohol use disorder or substance use disorder. You do need to be attending an approved drug or alcohol treatment or rehabilitation program. If you are already meeting the work requirements for SNAP or TFA, you will be considered to be meeting the work requirements for Husky D. So this is a sort of a nice opportunity to the extent that you might be able to support some individuals in ensuring that they're able to demonstrate SNAP work compliance. They may be allowed to therefore sort of tick off two boxes at once, because we'll be able to leverage that information from SNAP to give an exemption from the Medicaid work requirements. The parent or caregiver of an individual with a disability is another category. We also have individuals recently released from incarceration in the past 90 days. This is different from SNAP. This is a Medicaid-only exemption. Certain Native American and Alaskan Native populations, again, this has got a parallel to the SNAP program. And actually, foster and former foster youth are exempt in the Medicaid program, even though that exemption was just removed in the SNAP program. So there is a little bit of difference going on here, and you'll start to sort of pick some of these up. Hopefully this will serve as a preliminary tool for being able to sort of track some of those differences between the programs. We'll be sure to keep those differences very nice and clear on our website, so that folks who are trying to figure out if one set of exemptions works for SNAP might also work for Medicaid when they start. There are also there's a broad category called short-term hardship waivers. The example that the federal government has given to us to date about what that might include is such as individuals receiving medical care out of state. This is another area that may develop with additional federal guidance, and we will consistently share information as that we are potentially able to identify other types of short-term hardship waivers that might meet a Medicaid work exemption. Next slide, please. So here I'm going to jump into a little bit of data. I think that this is helpful potentially to set the framework so you can help understand how many people might be needing some support in going through the Husky D work requirements process. What we are trying to do here is use data that is available to the agency to help identify if someone is already compliant or likely to be exempt from the Medicaid work requirements. So we have a bunch of categories here under that second bar that adds up to 206,000 individuals out of our total 316,000 people enrolled in Husky D, where we have some data here at the Department of Social Services where we think that we will all by ourselves, with the client's permission, be able to determine if they are exempt or compliant. This is called an ex parte determination, if you want to sort of get into the jargon of the program. And it really means that the department will be looking at all of the sources it has available to it before asking our clients to provide information. This is, in many ways, the happy path that we like to think about. If we're able to determine that someone is compliant or eligible or exempt, we want to be able to do that all by ourselves. We think that that's a very helpful service to residents, and we already have an existing data source, so they don't have to produce information again. You'll see under that category that's one of the biggest ones is that medical frailty definition. This continues to evolve as we look at different ways of defining and describing that definition. We will put forward a lot more detail about what that means as we get additional federal guidance, and we settle on a definition for how it will be defined here in Connecticut. We also know that a lot of people who are on Husky D are already meeting the work requirements by virtue of how much money they make. We have access to wage records from the Department of Labor. Every employer who has to file unemployment insurance also provides information about people's wages that are part of that employment structure. So we know that about 94,000 out of those 316,000 people have earnings that will be above that $580 a month threshold. As you'll see, there's a number of other additional categories, some of the ones that I also referenced, right? If they're complying with SNAP work requirements, we know that there's 45,000 folks right now who are compliant with SNAP work requirements that would automatically allow them to check that Medicaid box as well. So altogether, we've got about 206,000 people that hit these exemption categories using DSS data all by itself. And we also know that those are not actually, those numbers underneath the 206,000 don't add up to 206,000 because some people are in multiple categories. So about 88,000 of the people might fall into two categories at once, such as they might be meeting SNAP work requirements, and they might also have wage data that would allow them to meet the requirements. So that leaves the rest of the population. That's that 110,000 at the very top of this chart. And those are the folks that are going to need some additional support in being able to determine compliant or exempt with their work requirements. They may have employment information that is not through a traditional employer, that they will have to provide some documentation about what they're earning. They may have a medical exemption, a medical frailty condition, but it's not one that we know about yet. Or they may meet some other exemption or compliance that we just don't have information about. So we call them at risk right now because we're really just trying to sort it out into the people that we know we have information about versus those that we don't know. That does not mean that 110,000 people are going to lose their coverage, but they are probably going to have to take some additional steps to see if they can demonstrate their compliance or their exemption. And so that's the population I think we'll really be looking to all of our community partners to help support as they have questions. We can provide information back to them as it continues to evolve and help them through the operational pathways as those start to get established. Of course, here at the agency, we need to set up some new pathways and channels for people to provide information. And we will also continue to look for data where it might be able to be available to us to sort of shrink that 110,000 number and move them over into that 206,000 category. We're constantly evaluating where we might be able to acquire additional information so that nobody has to provide any additional paperwork in order to maintain their coverage. Go to the next slide, please.
Peter, can we just pause here for a quick moment?
Certainly.
I just want to say that was a lot on that last slide. It is daunting and scary, and it both there's things on the slide that make me happy at the same time, right? And your statement that DSS is working to use the ex parte, my new favorite term, data that's already in your systems to identify people that we know have a disability or we know are meeting certain requirements, that we know are meeting the SNAP work requirements, will then fold over to meeting the Medicaid requirements, right? That you are working on the back end to make that magically happen without people submitting forms. It's magic. Without submitting forms and doing other things, that is how DSS is really stepping up and bringing that down that is a lot of folks, right? So I just want to say thank you for that, for those efforts. And seeing this is overwhelming, but definitely enlightening. Is there anything that folks should know about this process? Should we assume that if someone's on SSDI, that they don't have to do anything, that meets that standard for Medicaid or SNAP? Or do we need to be a little more proactive? What's the balance between those things?
Thank you, Amy. Appreciate the recognition. It takes a very big team to do what we are trying to do at DSS to try to do our best to help support, all of our Connecticut residents and everyone else who has a stake in ensuring that our healthcare structure is as sound as possible. Very specifically to your question about SSDI, we have that information. You will not have to reprove that you are enrolled in SSDI or SSI. That is known to us, and we will apply it in both the Medicaid and the SNAP context. So if for some reason you are serving someone who is receiving SSDI and it is not, and for some reason you think that is not being evaluated properly by the agency, please contact us. That is usually something that we have all the information on, but there's always an exception to the rule. All right. With that noted, I'm going to just walk through a couple of resources that people might be able to access, and then we can continue to answer some questions about either SNAP or Medicaid and how these work requirements are going to work here in Connecticut. So very quickly, I'll just a quick run through of some of these URLs and websites that might be helpful. Some of the phone numbers and community resource you might have. Connect.ct.gov is the best place to apply for SNAP benefits online. It has our online application. You can also renew. You can upload your documents, check your benefits. It works best on a desktop or laptop computer. We also have mydss.ct.gov. This is the mobile-friendly version where you can do everything except for apply. Just want to put a little asterisk there. That is used best for renewing your benefits, uploading your documents, and checking your benefits from your phone. We have our SNAP work rules pre-screener. Dan referenced this earlier. We think this is a really nifty tool. About 300 people a day are using it right now to help evaluate whether they are potentially subject to SNAP work requirements. And we are developing one that will be very similar for Medicaid. We do hope that we will have that available as an early screen. Again, it's not conclusive, but it gives you a really strong indicator of whether you are likely subject to work requirements and how you might be able to establish or identify an exemption that you might be eligible for. You can always call our benefit center. We have sort of holistic support on applications, renewals, and eligibility questions. We love when people self-serve and use the online services to the greatest extent possible because we are a finite resource. We work hard to serve everyone in the state, but it's a lot. But if you need to call us, we are there at that phone number. And of course, you can look to 211. Our partners here. I think we also have a link to the website on a subsequent slide. For general broad community resources. We love our partnership with United Way. Again, there's a whole range of potential services that can be accessed, recognizing that DSS, we administer certain programs and benefits, but we are not the only place to be able to receive support around the state. Our partners, the community action agencies, are one of our designated partners for helping us to support the changes that are happening right now at HR 1. So, big kudos to my colleague Suzette, who's on the call here and was introduced earlier. She's helping to lead the charge in ensuring that our community action agencies have all the tools that they need to help support clients. We really want, we're happy to have them as a force multiplier. They can help you with your SNAP applications and documents. They have a good understanding of the changes that are coming from HR 1 and you can help get support, in person or through their various channels with the community action agencies. We always appreciate the support of our American Job Centers, and of course, United Way's Volunteer CT. These are two of those channels where if people are looking for job opportunities, if they're looking for volunteer support, these are great resources to be able to access, to be able to point people towards where there may be opportunities available around the state. We will also be continuing to build out our network of locations where people might have an opportunity to volunteer and seek out employment. That is something that we are developing as we work on the Medicaid work requirements within the system that we're building to support that initiative. Next slide, please. And so for a quick and ready reference, here is where the DSS resource centers are located around the state. We do have 12 locations. We do have a good geographic coverage. If you feel most comfortable coming in person, that's always an option. We do have availability through, again, the phone, by mail, going online in particular. You often can support a client online through many of the actions they're looking to take. But here our offices are always available as well, and they're always staffed by our DSS eligibility team. Next slide, please. So just to give you some ideas, I think this is probably not something you don't already know, many of you, but just to sort of capture it in one place, we really appreciate how our outreach partners can help support us across a couple different categories of ways that folks might be looking for supports. If DSS is not the place for them because they're not meeting the work requirements and they can't, we love that you can tap into other networks that can help find local resources or other statewide opportunities. Our community action agencies serve as geographic hubs around the state. 211.ct.org or the 211 phone number, wonderful resources for referrals and other opportunities. Your local municipal social service offices are also a great partner. They are obviously keenly connected to the local environment and where additional supports may be available. And your faith-based organizations all around the state often play this role. They're always a key partner in all of our outreach and connecting efforts around this, around changes like this, and otherwise supporting folks in their essential needs. Other partners where you can get, some really important, valuable connections might be the FQHCs that often serve many of the clients who are receiving DSS benefits on the healthcare side of the world. We do partner with Connecticut Food Share and local food pantries. We have been able to allocate some state funding recently to help bolster pantries around the state, recognizing that as much as we wish we could keep people on the SNAP program, that for some folks who are no longer able to receive SNAP benefits, benefits that food pantries will need to become part of their support network. Our friends at the Diaper Bank of Connecticut and the Connecticut Hospital Association, which does a lot of work with on-the-ground community organizations to help support upstream pre-hospital activities. Ideally, we all want to be able to support people before they sort of have to get to the emergency room. That is always, of course, an option as well. What can people do on the ground to help support folks? Well, we think that sharing this information is very important. So we'd love for you to be able to share work requirement information, support folks with documentation, some of the exemption screening. We have that pre-screener. You might be able to support somebody by walking through that with them or pointing them in that direction. Benefits application forms, guidance on next steps. We also have online community partner access for community partners to help people enroll in benefits, to submit applications together. And you can also make referrals, of course, to the DSS Benefit Center for eligibility questions. We are, at the end of the day, we will be able to answer almost any question through our wonderful DSS eligibility staff. Next slide, please. So two last things we just want to leave you with before we turn to the Q&A section. A very important thing, which is a campaign that we have run before, but has never goes out of style. People should always keep their contact information up to date with us so that we can be sure that we are always sending out information to the most current address that people have on file, or the best email address, or for text messaging, the best phone number. We have a single website where you can go to at portal.ct.gov/updateusdss. If people don't know exactly where to go to update their information, that can serve as a great jumping off point. It'll help guide you to the right place depending on the benefits and services that you are receiving or looking to receive. And I also want to highlight, just for everyone here, the new URL that we are going to start using to transmit data about HR1 changes. This is something that is just getting underway. So if you go to portal.ct.gov/DSS-HR1, you'll see the starting point. Where we are today, we are going to be really building out that website with a lot of additional information, messages that might be very helpful for you as providers. There will be a section that is for clients as well. We'll have links to our pre-screeners and other tools, things like the volunteer form that we're working on developing, recognizing that no form is necessary to validate a person's participation in volunteering. We have heard folks request that there be a form available for folks who don't have the familiarity with some of the rules that we broadly accept. So we'll be putting that form on that website as well. Those things are all coming very soon, and there's a very good FAQ starting point on that HR1 website, which may answer some of the questions that are in our chat, and also hopes we will continue to take questions like those that have been posed today and load them onto the website so that we have a running resource of information related to HR1 at that address. I believe that brings us to the end.
Wow.
Maybe we still have some minutes for Q&A, or we run out the clock and we have to
We are at
we can.
2:59 and acknowledging we still have 77 questions in the chat. So you're all full of questions and I completely get it. A lot about the mix of volunteer and work, kind of what trumps is the amount of money for volunteer or work more important than the number of hours, since our wages are different than the federal wage. Forms. And of course, a lot of concern about populations, chronically homeless, people in domestic violence shelters, right? You did a great job. Thank you in highlighting what are the current exemptions, what has fallen away in terms of exemptions, and then the difference between the SNAP and the Medicaid exemptions. That is enough to keep us all awake for the next several months. I know it has kept you all at DSS awake for many months at this point in time. Thank you for the thoroughness. Thank you for introducing the link to the new website and the commitment to keeping us updated, and informed. We all know where we can go and to peel through these questions. Thank you for all the work, and in advance for the work that's to come to answer a lot of these questions and to make this work as best as we can for people in Connecticut. I know that is your sincere and very real commitment from Connecticut Department of Social Services. Commissioner, do you want to close us out?
Thank you for having us. You can see that it takes an hour just to explain at a very high level what is going on. I might put my staff on the spot and say that we're happy to schedule another time to meet with you. They knew I was going to do that anyway, because you might benefit, Amy, you and our providers from just having a Q&A session where all of these questions that you've posed can be answered in real time in about an hour, because I know it's difficult to do that. So we'll commit to that if we can find another time to get that done. But thank you for being here, and thank you for giving us the time to reach out to our partners. And Suzette, again, Dan, and Peter, thank you for all of your hard work on this.
Thank you, everyone. We're all in this, and I know people working furiously, and not all the answers that everyone would want. Sometimes we don't like the answers we've got, but we're all working forward. And just to say, SNAP and Medicaid are still some of the largest investments our government makes in people's well-being. So there's I get it, a lot of bad feeling, a lot of bad news, yet they are critical life-saving investments. So please, if you think someone is eligible, still apply, right? Like, let's not turn off and stop people getting these critical benefits. As we work to make sure people stay on, let's make sure new people get in the system, because these are literally life-saving benefits for people in Connecticut.
Amy, I know we're a little bit over time. I did want to add this. It's so your last point is so salient and so important. Remember that the Medicaid changes relate to a specific population, and that population was identified because we get the highest level of reimbursement as a state for that population, and it's also intended to put close attention to a particular population that the administration believes should be working because of their composition, right? Because of their characteristics. But there are many other categories of Medicaid that the state offers. So please do not hold back on really encouraging people to get medical coverage, because that's what keeps Connecticut healthy. So thank you for that.
Oh, it was a beautiful way to end. Can't say more than that. Mic dropped. Commissioner, thank you, everyone. As you said many times, I'll say again, materials will be sent out. Webinar will be sent out to everyone who registered, and we'll be posting them on our website. And I hope you wrote down that link. We'll certainly be blasting it out for the new DSS link to go to track all this information and more. And have a wonderful afternoon. Thank you, everyone.
Thank you. Thank you.